It's already been linked to a number of serious health risks, and now the controversial chemical bisphenol A, or BPA, is back in the headlines.
Investigator Ryan Cass spoke to the University of Missouri researcher leading the charge to have BPA banned. Ryan?
Mark, Mizzou scientists turned heads when they found significant levels of BPA on cash register receipts. And tonight, a just-released study says we're being exposed to the chemical at a much higher rate than originally thought, and from sources we're not even aware of yet.
You probably touch one every day. And depending where you work, you could be handling hundreds of these every week.
The surface amounts of bisphenol A on about 40% of the papers that we analyzed were astronomical.
Mizzou professor Frederick Vumsal has been blowing the whistle on BPA for more than a decade. He and Professor Julia Taylor recently tested receipts collected from across the country by the Washington-based Environmental Working Group. After cutting up receipts, putting them in test tubes, and stripping away the products on the paper, they found BPA in receipts from several retail giants, even the ultra-health conscious Whole Foods, and the U.S. Post Office.
It's inconceivable that cashiers are not being exposed at high levels to this chemical.
For years, BPA has been a key ingredient in plastics and the lining of metal cans. However, it's been under the microscope for possible links to diabetes, cancer, obesity, and heart disease in adults, along with brain and development problems in young children. Vumsal says the way the chemical is used on receipts is even more potent because it can rub off the paper and onto your hands.
If there are alternatives already, why use BPA when we know it's exceedingly harmful?
Some chains like Starbucks and Target scored well in the study. Their receipts had only trace amounts or no BPA. So how do you know if the receipt you're touching contains the chemical? That's the problem. You don't.
We have no idea what products they're in, so we have no idea how to avoid this chemical.
Unless manufacturers of BPA are required to start labeling those products for the public,
we can pull out a receipt.
It could take lab work like this to let us know what other ways we could be exposed.
So since you can't tell if a receipt is made with BPA just by looking at it, here's what the professor recommends. Your easiest option is just having the cashier throw away the receipt if you don't need it. Otherwise, he says to store receipts in a plastic bag instead of your wallet, purse, or pocket. And after touching a receipt, wash your hands before eating or preparing food. And Mark and Elizabeth, in this case, hand sanitizer isn't a good option, he says, because that can actually make your hands more absorbent, and scientists are still trying to figure out how easily BPA can go from your hands into your system.
Wow,
it is pretty scary when you think about it. We probably touch one or two a day, but what about the cashiers and the store clerks who go through hundreds a day?
Hundreds a week, probably, or thousands a week, who knows? He's saying since you don't know where the receipt is coming from if you work at a store, that you should probably actually wear protective gloves for now. But his hope is, just like we saw with baby bottles, where they're now advertised as BPA-free, manufacturers of receipt paper are going to wise up and start marketing their paper as BPA-free as well.
Great
I had no
story.
idea.
Thanks, Brian.